Good afternoon. I'm here to provide Alberta's update on our COVID-19 response with Chief Medical Officer for Health, Dr. Deena Hinshaw, and I also am being joined by Minister for Environment and Parks, Jason Nixon, who's available for questions on aspects of the federal support package for the energy sector, which I will also be addressing after I present today's updated COVID-19 numbers. In Canada today, there are a reported 30,697 infections, and the number of deaths attributed to the virus is 1,252. The number of recovered cases is 10,092 across the country. The combined number of confirmed and probable infections here in Alberta increased by 239 over the past 24 hours. There has been a substantial increase in confirmed cases in the last few days because we have been once again stepping up testing, and that is a good thing. We have been increasing testing to 3,831 in the last 24 hours alone. And I'm glad to see that with the expansion of the population eligible for testing, together with our expanded capacity, we're seeing those numbers come back up. A total of 2,397 Albertans have tested positive to date, while the total number of recovered cases now stands at 1,124. Thankfully, no new deaths have been reported since yesterday, and so the total number of fatalities remains at 50. The most encouraging news in Alberta continues to be our consistently low rate of hospitalizations and ICU admissions resulting from COVID-19. Today, 60 Albertans are being treated in our hospitals for COVID illness, and 13 are in intensive care units. So the hospitalization total is up by about 10, and that is something to remind us that we're far from being out of the woods on this, and the numbers can change very quickly. However, we continue to see far fewer hospitalizations than even the most optimistic scenario described by the AHS modeling, which we released last week. As of today, we have conducted 89,144 tests, and we've averaged 1,974 per day since the 4th of March. AHS testing protocols, as I just said, have evolved during the outbreak, adapting to the trajectory of the virus, as well as the availability of testing resources. Initially, testing focused on international travelers, the primary source of early infections, as well as frontline healthcare workers. As community spread began to grow, we shifted to more people showing symptoms, especially Albertans who were more vulnerable to severe illness. This week, AHS extended testing to everyone exhibiting cold or flu-like symptoms. And in light of the severe outbreaks in some long-term care facilities, AHS has been aggressively testing everyone showing symptoms in those facilities, as well as, of course, sharply limiting public access to them and putting in place a number of other protocols to protect our seniors. To ensure that we get those outbreaks under control as soon as possible, more must be done. So we are announcing today that in the coming days, we'll be testing all residents and staff in continuing care facilities that are experiencing outbreaks, whether those people have symptoms or not. So a further increase in the testing protocols for continuing care facilities because of their particular vulnerability and our ability to do so with our expanded testing capacity. This will help to contain the spread among residents and protect the compassionate and courageous workers who are caring for them in those seniors' facilities. Those workers are among the more than 1 million Albertans who are still on the job every day, despite higher risks, providing important supplies and services for all of us. And that includes many tens of thousands of essential service workers. We need to keep them healthy, so as our ability to expand testing increases, we'll be moving as quickly as possible to test more workers in essential services in outbreak contexts, and Dr. Hinshaw will provide more details in a moment. All workers from all companies at outbreak sites will have access to testing, and our capacity to increase testing, both in the symptomatic general population and the asymptomatic essential worker population, is growing quickly. Our maximum testing capacity is currently approximately 7,000 samples per day, and we're working on continuing to increase that. As I said last week, our stretch goal ultimately is to achieve 20,000 tests a day, and we continue to do work on analyzing the application of fast response testing units, as well as the potential for serologic or antibody testing. So all of this will be the foundation of our relaunch strategy that I began to outline last week. And I should also say that another key element of our relaunch strategy will be a very strong policy to build a wall of defense around our most vulnerable seniors, in particular, those in continuing care facilities, and we'll be discussing that further at our Emergency Management Committee of Cabinet next week. Albertans should be very proud of how we have come together to fight and defeat this pandemic. As the increase in hospitalizations and number of infections confirmed today underscores, we are not out of this. I know we're getting increasing calls from members of the public to reopen everything right away. But as I said last week, doing so and letting the virus loose would risk us having to come back with an even more stringent and widespread lockdown that would have even more devastating impact on our economy. So as we begin to plan the details of our relaunch strategy, we please remember, I say this to all Albertans, please remember that the best way we can reopen key aspects of our economy and get back to something like normal is if we continue to show discipline. And that means for so many of us, making sacrifices so that we can contain the spread, and then that will allow us as a cabinet, as a government, and I know that the Chief Medical Officer will allow all of us to move forward more quickly with reopening. Today, I would like now to make a statement about the very important announcement made earlier today by the Government of Canada in critical support for the Canadian energy sector. There were three elements to today's announcement. Firstly, a $1.72 billion contribution to the governments of Alberta, Saskatchewan, and BC, as well as the Alberta Orphan Wells Association, to clean up orphan and/or inactive oil and gas wells, creating thousands of jobs while also having lasting environmental benefits. This is a package that we have been working on with Ottawa, frankly, since last summer, because we were still in challenged economic times 9 months ago, not as bad as now, but we have underscored this is a really efficient way of getting good blue-collar, skilled labor back into work, folks who have been laid off and who are maybe right now facing unemployment in the oil field services sector. This is an important lifeline for hundreds of companies, large and small. This is going to breathe new life into many rural communities where small service sector companies are a key part of the local and regional economy. And this is in addition to the hundreds of millions of dollars that the Government of Alberta has lent to the Alberta Orphan Well Association. So this will allow for a surge of well reclamation and completion work all across the province, we hope starting immediately. And I want to thank the Government of Canada for having heard our message about the importance of this in the midst of the economic crisis especially. In addition, they announced up to $750 million to create a new proposed emissions reduction fund to reduce emissions in the Canadian oil and gas sector with a focus on methane. This will provide primarily repayable contributions to conventional and offshore oil and gas firms to support their investments to reduce greenhouse gas emissions. And Minister Nixon can provide further details, but he's been working very closely with his federal counterpart on a package of this nature, part of which we hope will be the finalization of an equivalency agreement with Ottawa on methane regulations, pardon me. And then thirdly, they've announced the expansion of the new business credit availability program to help Canadian businesses get the financing they need, expanding that to include specifically small and mid-sized companies in the oil and gas sector. with loans varying between $15 million and $60 million a year, offered at commercial rates, repayable within 4 years. And the deployment strategy for the Business Development Bank of Canada's COVID-19 oil and gas sector financing will be finalized shortly. So this is also an important measure to provide for liquidity for many hundreds of small and medium-sized oil and gas companies, most of which, the vast majority of which are here in Alberta. These three measures combined, I think, are very good news when we so desperately need it in this province's largest industry, in fact, the country's largest subsector. And let me just remind, first of all, once again, I want to thank the Prime Minister. I want to thank Deputy Prime Minister Freeland, so working so closely with me on these initiatives, and Finance Minister Bill Morneau, who's been in almost daily contact with Alberta Finance Minister Travis Toews on these and additional measures that we hope to see announced in the days to come. I also want to thank my fellow premiers. We were on a call yesterday with all 13 premiers. And once again, I've heard over and over tremendous solidarity and understanding of the importance of the Canadian energy sector and support for federal action to ensure a future for this vitally important part of the national economy. And I want to remind our fellow Canadians from coast to coast that when we were in the midst of the global financial crisis 12 years ago, that the national government stepped in to ensure a future for the central Canadian auto manufacturing sector. So that was the right thing to do. It helped to save that sector, and with it, hundreds of thousands of jobs. But during that global financial crisis, one of the reasons Canada got through it stronger than virtually any other developed country was primarily because of the strength of the Alberta oil and gas sector. At that time, we drove national growth during the global financial crisis in 2008-9, and that is one expression of how Alberta has always been there to help the rest of the country. This is a sector that helps to sustain approximately 800,000 jobs directly and indirectly, that generates tens of billions of dollars of revenue, more than any other industry in the country, revenue that goes to support things like world-class healthcare, the system that we all count on right now. But I just need to close with this by saying that more needs to be done. While this was a very important step forward today, and we'll work with the industry to make sure that this money is out there, creating jobs within days, more must be done, because the reduction in output by OPEC Plus that was announced earlier this week of, I believe, 9.5 million barrels per day has not changed the fundamental market conditions. In fact, I see that WTI prices are down again to under $20 today, and Western Canadian Select closed at $4.62, down 38% today. So the OPEC Plus production cuts have had no impact on global prices because of the surge of supply from OPEC Plus in the last month in the face of a catastrophic reduction in demand. And so I want to once again reiterate the urgency of the national government stepping up to ensure liquidity for this, the largest subsector of our economy, the largest export industry of Canada, a point that I made very strongly yesterday on a call with the Prime Minister at the First Minister's meeting. So we'll continue to work for additional action, but we are grateful for today's announcement. And with that, I will invite Dr. Hinshaw to provide her daily update.
Thank you, Premier. Good afternoon, everyone. Before I give my update, I want to acknowledge that I know that Albertans were disappointed that I did not share information on the Foothills Hospital maternity ward situation before yesterday. I have heard clearly that Albertans rely on the information I share about unusual situations, regardless of whether or not these situations pose a public risk. Going forward, we are working to include information on all confirmed COVID-19 outbreaks on our webpage to support my commitment to be as transparent with Albertans as possible, while still protecting personally identifiable information. As part of this transparency, I want to be confident that any outbreak site is informed of this intent before their information is posted online. We want to be sure that Albertans with loved ones in these facilities are getting timely information from the facility itself and will not hear about an outbreak from our website. I expect to be able to update Albertans on this information by early next week. I am pleased to report that our surveillance information is back online following the disruption earlier this week, and I want to thank the crews who worked tirelessly night and day to make that happen. With this new data, as the Premier reported, we have identified 239 new cases of COVID-19 in Alberta in the last 24 hours. This includes 134 lab-confirmed cases and 105 new probable cases, which is a combination of the last 3 days' numbers of probable cases. While this number is a high daily total, I want to remind people that we did expand our testing access this week, and we expected to see more new cases as we test more Albertans. As you heard earlier, in the last 24 hours, we did 3,831 COVID tests. Another reason for the recent increase in case numbers can be attributed in part to a surge in cases identified in households linked to a meatpacking facility in High River. There are now 358 cases linked to this outbreak, involving multiple connected households. Some of these households are in surrounding communities, such as Calgary, and current information suggests that the cases in this outbreak are primarily linked to household transmission. Alberta Health Services has put together a dedicated outbreak response team to track this High River outbreak and to prevent further infections at any locations where transmission is occurring. Today's new cases bring the total number of Alberta's COVID-19 cases to 2,397. Of these, 1,124 people have recovered. We suspect 400 of our total cases may be as a result of community transmission from an unknown source. This number has increased and is a concern. The locations where transmission is happening will be part of my update next week once we have had more time with the data. Given that we lost 2 days of access this week, we have not had time to do this yet. There have been no new deaths over the last 24 hours, leaving our total at 50. Of these, 32 were in residents of continuing care facilities. I know that people who have loved ones in long-term care and continuing care facilities are concerned about the risk of infection at these sites. I am too. It is not acceptable that elderly Albertans are being put at risk in a place where their health is supposed to be protected. We have put strong measures in place to limit the spread of infection at these facilities. We must do more. That is why I am working with Alberta Health Services to expand testing in the units of continuing care facilities that are experiencing outbreaks to now include asymptomatic residents and staff. This expanded testing does not replace or change any of our outbreak measures, and a negative test in someone with no symptoms does not change a need to be isolated for 14 days if they are a close contact of a confirmed case. What it does is gives us a better chance of early identification of new cases. Given that we now know people who may be infected with COVID-19 can potentially spread the illness before they show symptoms, testing more residents and staff in continuing care facilities will help us prevent further infections and deaths. Having said that, testing is only one part of the larger response, and it must be taken in that context. I know staff at these sites are doing everything they can to keep these residents safe, and we will continue to support them by ensuring our requirements around visitation, sanitization, and personal protective equipment are rigorously followed at all times. We cannot let up on these requirements during this crucial time. One particular situation I wish to inform you about today is the outbreak at the Manoir du Lac Continuing Care Facility. Earlier today, Alberta Health Services issued a news release indicating that they will be taking over administration of this facility after public health determined that protocols for keeping residents safe and well cared for were not being followed. The health and safety of residents in our seniors' care facilities is of utmost importance, and these measures are being taken to ensure that residents get the care they need. While we are focusing on this group at the highest risk of severe illness, we still need to protect each other in the general population as well. We must continue to stay home when possible, practice physical distancing when we need to leave the house, and if we experience any of the symptoms of COVID-19, including fever, cough, runny nose, sore throat, or shortness of breath, we must self-isolate immediately and complete an online self-assessment at the Alberta Health Services website to be referred for an appointment for testing. If you do not have online access, you can call 811 for this referral. If you were directed to get testing through these referrals, please do so. Testing is incredibly important to our COVID response strategy. It helps us trace the spread of infection in our communities and identify any outbreaks as soon as possible so we can work quickly to address them. With increased testing, we will find more cases, and that may bring new exposures at workplaces into view. This gives us an opportunity to be sure that contact tracing and measures to prevent infection are put in place. We are using asymptomatic testing in select outbreak contexts as an additional tool in the toolbox of local public health to make sure that those sites that have outbreaks have access to testing where it's needed and where it can help identify cases early and prevent spread. This knowledge that we will be identifying new cases also gives an opportunity to prepare proactively. I want to remind all employers that you have a responsibility to prevent the spread of infection at your worksite and protect workers and any members of the public who may enter that site. I know many businesses are eager to reopen and serve the public. We are not at that point yet, but continuing to follow public health orders and guidance will help us get there sooner. Thank you, and I'll be happy to take questions.
Okay, operator, can you please put through the first caller?
Our first question comes from Kelly Kreiderman of the Globe and Mail. Your line is open.
Hi, Kelly.
Hi there. Sorry about that. Hi, Premier. You talked about this only being a first step in terms of aid to the industry. Can you talk at all about what you would like to see happen next and what talks you are in with the federal government in that regard?
Sure.
And as this money comes out, is there a way of ensuring that it goes to preserving jobs and not to, say, executive bonuses or the like?
Yes, well, absolutely. First of all, with respect to the Business Credit Availability Program that was initially announced on March 13th, 2020, today expanded to include small to medium-sized oil and gas companies with access to commercial rates of credit for loans of between $15 and $60 million. And this is limited to, the funds must be used for operational cash flow and business continuity purposes. And qualifying businesses must have been financially viable prior to the current economic environment. So those are criteria that have been in the federal program, the Business of Credit Availability Program delivered by BDC since it was launched a few weeks ago. And when it comes to the well reclamation program, similarly, that's money that will have to, the program criteria will be very clear and strict. That can't go to things like bonuses or dividends or anything except actually doing the work. So we'll be launching a procurement process to take a large inventory of unremediated wells to complete that work. More details will follow, but it's about, and in fact, we've already been, because we've been expecting a program like this for several months, Minister Nixon at Environment and Parks and Minister Savage at Energy have been working on streamlining the process to accelerate well reclamation work. To be blunt, we want to see that money being spent to hire folks in the field doing the actual work and not armies of consultants issuing endless reports. So we're trying to cut the red tape around well reclamation to make sure that money gets to work creating jobs in communities right now. On your first question of what more are we asking for? Well, we've been emphasizing the need for extraordinary credit backstop to support liquidity in the Canadian oil and gas sector. We've been working very closely with the industry and the Government of Canada. And our estimate is that something in the range of $15 to $30 billion is required in terms of credit backstop to allow for liquidity through access to commercial rates of credit. This would not be the only sector that would need that kind of extraordinary backstop at this point. Obviously, the Canadian aviation sector, our airlines, tourism, would be other industries that have been particularly hard hit. And I think what the federal government is looking at is a broader package for industries that have really been sideswiped at this time. And we continue to work with them on that.
Operator, can you please put through the next caller?
The next question comes from Dylan Short of the Edmonton Journal. Your line is open.
Hi, Dr. Hinshaw. I was wondering if you could expand on why these new tests for asymptomatic people in outbreak centers is coming now. Is it just a matter of capacity, or is there something else there? And is this in all centers or just in the ones where there is identified outbreak?
So we've talked before about testing in asymptomatic groups, and I've always said that the most important testing that we need to do is in those people who have symptoms, because those are the people who have the highest chance of having COVID-19. And those are the people that we need to make sure that we're testing to ensure that we can do our contact tracing and containment. And so earlier this week, as you know, we announced that any Albertan with any symptom would be able to access testing. And since we've done that, we wanted to give that a few days to be able to know whether or not we had capacity left over. And so again, we're kind of moving through our priority list. And what we've seen is that we did have an initial surge of the number of people who were being referred with symptoms. And then after a few days, we've seen that settle out a bit. So we have capacity now to be able to expand our testing to those who do not have symptoms in these outbreak contexts. We're focusing on contexts where there is a confirmed COVID outbreak because those are the cases, those are the settings where we have the highest chance of having somebody who actually has COVID. And also, as we've talked about before, when we test someone who has no symptoms, it is simply a snapshot in time, that result. So if we were to expand testing, for example, in other long-term care facilities where there are no outbreaks, it does not guarantee that there is no COVID exposure. It's simply a snapshot in time. And so we have to make sure that we're using our lab resources as strategically as possible and focusing on the areas where we know there's risk to be able to control that risk and make sure that we're focusing again on preventing spread and preventing severe outcomes like death.
Operator, can you please put through the next caller?
Our next question comes from Julia Wong of Global News. Your line is open.
Hi, Dr. Hinshaw. Just a quick two-pronged question. Is the province planning to release any updated modeling, and if so, when? Also, BC is looking to ease its restrictions by mid-May. What impact could that have on Alberta, since our restrictions won't be eased until the end of May at the earliest?
So what I would say about modeling is that our teams are looking at our current numbers and inputting that into updated models. But we haven't had discussion yet. I haven't even seen those new models yet, so I'm not sure when we'd be in a place to release those, so that will take some discussion. With respect to BC's planning, certainly we are having discussions across the country with my colleagues, the chief MOHs in all the provinces and territories, about trying to make sure that we're coordinating and keeping each other informed about our plans. Obviously, each province and territory needs to make plans that are relevant to their own situation, to the numbers of cases that they're seeing. And so, you know, each province and territory will have to move at a different rate depending on what they're seeing. With respect to planning in Alberta, that's under active discussion. So I think, you know, we talked earlier when the modeling was released about different timelines, but that's constantly under discussion, and we'll be My team in public health will be bringing recommendations throughout the course of our response on whether or not we might consider, what times we might consider lifting recommendations for public health measures. So I think Albertans perhaps should know that we will have to have some restrictions in place for a long time, but not necessarily to have a fixed date in mind about when any restrictions might be lifted. And again, that's under discussion, and we'll be, from public health, bringing recommendations on an ongoing basis forward to the Emergency Management Committee of Cabinet for ongoing discussions on when it might be appropriate to lift measures.
Operator, can you put through the next caller, please?
Our next question comes from Kevin Nimick of CTV. Your line is open.
Hi, Dr. Hinshaw. We've heard from the family of a man who died at Mackenzie-Town long-term care that he wasn't given the option to receive treatment at the hospital. So what's the protocol, and are certain people being prioritized for hospital care?
So the protocol that I'm aware of is that if someone becomes ill with COVID-19 in whatever setting they live in, whether that's a long-term care setting or any other setting, and if they become more significantly ill than can be managed, whether it's in their home or whether it's in a congregate care setting, it's my understanding the protocol would be that there would be discussions with that individual, with their family, if appropriate, and that person's goals of care would be taken into account as to where they could receive care. So I don't know about any specifics of individual cases, but the protocol that's in place does not restrict people from receiving care in the location that's most appropriate. So I'm not sure. I can't comment more on that specific case.
Operator, can you put through the next caller, please?
Hello, next question comes from Tyler Dawson of the National Post. Your line is open.
Thanks. Dr. Hinshaw, is there an update at all on the Curl Lake outbreak? And my larger question is, people who are flying in and out of oil sands work camps, should they be self-isolating or something upon going back home?
So with respect to the Curl Lake outbreak, as of today, local public health informed me that there are 12 cases in Alberta that have been confirmed that are linked to that site. And there are several other cases in other provinces that have also been linked to that site. So we're working with public health and with the company to get lists. And sorry, there are multiple companies. I should be clear about that. So on the site, there are multiple different organizations. And so we're working to get lists of anyone who may have been exposed. So we can make sure to provide those lists to other provinces. So we can do typical contact tracing. So anyone who was at that site recently, we would be asking them to self-isolate for 14 days as we would do with any other close contact of a confirmed case, and that work is underway. But with respect to that question about any work camp setting, I would not recommend that happen for any work camp setting. We're focusing specifically on this one setting where we know there have been cases and exposure.
Operator, can you please put through the next caller?
Our next question comes from Jeremy Thompson from CTV. Your line is open.
Hi, Dr. Hinshaw. Just a quick question for you about as the weather is warming up here, obviously places like parks and sports fields and stuff are still open. As people start to go into those spaces, what should they sort of keep in mind as they look to observe the rules and restrictions while still enjoying themselves?
Absolutely, and we've had a very long, delayed winter, so I'm sure that Albertans are very keen as the weather looks to warm up over the next week or so to get outside, to enjoy the fresh air and sunshine. But I do want to remind Albertans that it is important to stay physically distant from others. And so thinking about what you can do when outside, that you can do in smaller groups and groups where you can stay distant from each other, I recommend that if you're going outside with your family or your household, obviously if they're people that you live with, then those are people that you can be closer together with. But for example, if you have children, thinking about activities that they might be able to play, so perhaps limiting, and I know many playgrounds across the province are closed, but playgrounds are areas that have a lot of high touch surfaces and kids would potentially be exposed to virus is on the surfaces that other children are touching. So thinking about activities like flying a kite, kicking a soccer ball, doing things that aren't going to put kids at risk of being exposed. And for adults, again, making sure that you're thinking about activities that you can do outside, going for a walk, riding your bike, doing things that you don't necessarily have to be close to other people in order to do. But absolutely, being outside and enjoying the sunshine is going to be great, especially after this last round of poor weather we've had.
Operator, can you please put through the next caller?
Our next question comes from Dean Bennett of the Canadian Press. Your line is open.
Thanks. Just 2 points of clarification from Dr. Hinshaw, please. You mentioned you're expanding the testing at continuing care centers that have outbreaks. How many centers is that? I think the last count was 22 or 27. And also, your remarks off the top, can you confirm then you're not tracking any other outbreaks at direct care centers, such as hospitals?
So right now we have 34 sites, continuing care sites, where there's been at least one confirmed case of COVID. And as I mentioned earlier, we will be putting that list up on our website next week. But we do need to confirm with those facilities that all staff and residents have been notified, making sure that we're not surprising anyone with respect to that list. And there are no acute care outbreaks that I am aware of, that I've been informed of. So the only one that I've been aware of is the one that I talked about yesterday with respect to the Foothills site.
Operator, can you put through the next caller, please?
Our next question comes from James Keller of the Globe and Mail. Your line is open.
Hi, a question on the expansion of tests to all residents in long-term care centers with outbreaks. Does this include retesting? Like, in other words, if you get a test in everyone today and you've got people that are negative, how are you sure that they're not infected a few days later? You talked about a snapshot in time. I think this is part of that.
Yeah, absolutely. And that's, again, the limitation of testing people who have no symptoms. And it's why I wanted to really underscore the importance of all the other outbreak measures that are in place that will not be changed by this new measure. So we are not going to be doing daily testing of everyone in long-term care centers with outbreaks. What we will be doing is using this as an additional tool, and I've talked with colleagues in other provinces who've used this as an additional tool when there is an outbreak to do a sweep of a snapshot in time, particularly at the beginning of an outbreak. It can help with early identification of cases. Once the outbreak measures have been put in place, limiting contact, limiting spread, it's less likely that you would have transmission happening in that facility. So it is most useful at the beginning of an outbreak, or if you're seeing an outbreak that hasn't been brought under control. But typically we would not be doing repeat testing. There would be, unless there was a public health reason to do so. But this would be a measure to enhance early outbreak control that we'd be adding.
Operator, can you put through the next caller, please?
Our next question comes from Graham Thompson of iPolitics. Your line is open.
Hello, I have a question for the Premier. Just to go back to something that Kelly Creighton was asking about, like a follow-up in terms of what else do you want. I think you were asking for up to, I think, $30 billion from the federal government. If you got roughly $1.72 billion today in the orphan well and other things dealing with methane, then you want another $28 billion. Would that be in terms of liquidity and loans? What else would you actually want in terms of a concrete answer from Ottawa?
Well, Graham, what we've done is to identify the quantum that of action that would be necessary to ensure the Canadian oil and gas sector survives this crisis, and we estimate that to be between $15 and $30 billion in liquidity measures that could be addressed through credit backstops, so essentially a form of loan guarantees, or one of the ways the Government of Canada has done this to date for a number of sectors and businesses is through the Export Development Bank of Canada and the Business Development Bank. In some cases, these instruments are also being delivered by the chartered banks, using the backstop of the federal government that's being administered by BDC, EDC. So that would be one model, and we don't yet know where that's. We haven't got a final indication from the Government of Canada, but we do know that they are looking at a broader range of credit facilities to allow for liquidity for industries that have really been hammered. during this crisis, and that would also include the aviation sector, the Canadian Airlines, and for example, the tourism sector, which has basically been shut down completely. So we're not asking for, to be clear, we're not proposing that the federal government write anybody a $15 or $30 billion check, but we are saying that they could play a critically helpful role in providing effectively forms of loan guarantees to ensure access to credit for these businesses to get through this crisis time.
All right, we'll take one more and then wrap up. Operator, can you put through the last caller, please?
Our last question comes from Myrna of Radio Canada. Your line is open.
Yes, thank you. First, Monsieur le Premier ministre, est-ce que vous pouvez réagir à l'annonce d'Ottawa, étant donné qu'on parlait des besoins énormes en liquidité, à quel point vous êtes satisfait de ce qui a été annoncé jusqu'à date et qu'est-ce que vous attendez pour la suite? And I also have a question for Dr. Hinshaw about exactly what wasn't being done at the Manoir du Lac and what will you be doing differently?
Très bien. Nous sommes très heureux avec l'annonce d'aujourd'hui du gouvernement fédéral pour une montant d'aide pour créer et sauver les emplois dans le secteur d'énergie, le plus important secteur industriel du Canada. Alors, 1,7 milliard de dollars pour la réclamation des puits de pétrole va permettre milliers de travailleurs d'avoir les emplois dans les mois à venir. C'est un projet sur lequel nous avons travaillé de près avec le gouvernement fédéral depuis plusieurs mois. Et c'est un transfert aux gouvernements provinciaux ici en Colombie-Britannique et Saskatchewan. Deuxièmement, il y a 700 millions de dollars pour accélérer la diminution de gaz à effet de serre dans l'industrie de gaz et de pétrole. Et ça va également nous permettre d'améliorer les performances environnementales du secteur de l'énergie et créer les emplois en même temps. Et enfin, il y a eu l'appui pour les prêts pour les producteurs de l'énergie, petits et moyennes, les petites et moyennes entreprises dans le secteur d'énergie. Alors, tout ensemble, je crois que c'est une très bonne étape, mais nous continuons de mettre l'accent sur les besoins plus larges pour permettre une future pour cette industrie avec les mesures de crédit, par exemple, les garanties de prêts. Et on a besoin de plus d'action. J'aimerais remercier tous les premiers ministres de leur appui pour une future pour cette industrie. Il y a 800 000 emplois au Canada qui sont liés à l'industrie énergétique directement ou indirectement. Et il faut rappeler que dans la crise économique en 2008, le fédéral a sauvé effectivement l'industrie des automobiles et le secteur d'énergie de l'Alberta a vraiment aidé l'économie canadienne pendant cette crise-là. Donc, je crois que c'est une question de solidarité nationale. And I'll hand it over to Dr. Hinshaw for your second part.
So the question about Manoir du Lac, the identification of issues at that site included problems with not enough staff and those staff who were at the site working extremely long shifts, inadequate screening of staff who were presenting and inadequate screening of visitors as required by my orders. There were inadequate care standards, so the care standards for residents were not being met, and personal protective equipment was not being used properly. So Alberta Health Services will be taking over management of that site, instituting proper infection prevention and control measures, and making sure that all of the Chief Medical Officer of Health orders that I have put in place will be followed, including screening of staff and visitors using appropriate personal protective equipment and getting sufficient staff at the site to properly care for residents.
Okay, we'll leave it there. Have a great weekend, everyone.